Hey, good morning, and welcome to the UroPateint podcast. I'm your host, Vic Sinise. We meet every Saturday at 10:30 a.m. Central Time. And if you're watching us live, we're on YouTube and Facebook Live every week. And you can always watch our on demand by going to our UroPateint.com website, where you'll find all of our past episodes. Also, the best place to go to get any of our handouts, we've got a bunch of them, so go and check those out. Every program I put out, I have a handout with valuable information for you guys. So let's get started with our show this week. Now, we know historically the treatment for bladder dysfunction has been a Foley catheter. Somebody comes in, they can't urinate, we put a catheter in and send them home. And then we try some treatment down the line, whether it's medical, surgical, whatever. We know that patients also treat their own incontinence when they start getting problems like overflow. They just start wearing diapers, thinking I can't control my urine and not realizing it could be retention. And even condom catheters are available, so they can get those. So people are pretty ingenious about how they can treat their own problems. Now, one of the problems is long-term Foley catheter is not a good solution. We know if you wear a catheter, there's going to be an odor. And I ask my audience, is this what you would consider quality of life? Running around with a Foley bag tied to your leg, a smelly bag sometimes. So I would say absolutely not. It's not a quality of life. So it's a quality of life issue to me. And so that's why I say intermittent catheterization. Why not you? A lot of patients will say, I'm not, I don't have any skills for that. I'm not in the medical stuff. And I'm like, no, you don't understand. This is a better solution. And I think the best thing is to get rid of the catheter. Now, anytime we put a catheter into a man or a woman, we are making a judgment call. We're basically saying that you're not sexual, because I don't know of too many couples that continue to have sex when they're wearing a Foley catheter. The World Health Organization, the WHO, in 2002 actually put this statement out: avoid an indwelling catheter if possible. If assisted bladder drainage is necessary, clean intermittent urinary catheterization should be used. I don't like to read slides. I know you can probably read it faster, but I think the message is clear. We should be encouraging intermittent cath. So we need a superhero. Now, I'm going to go through some of my teaching strategies. Hopefully these are useful for you. But I think it's always important to, have a positive attitude with the patient. This is something you can do. Let them know you're an expert. You've taught people before that this is going to be a good thing for them. And make sure they're ready to try. Some people will say, no, I can't do it. Okay, so next catheter change, offer it again. You get the right moment, you'll be able to be successful. Now, here's one of my big pet peeves. How many times have, and I love our catheter salespeople. They come in with all these samples. It's great to have them to give to the patients to get them started. But I've had a few come in with this bag of catheters, loaded with catheters, and they say, what you do is you just give this to the patient, send them home with the instructions, and tell them to let you know which catheter was the easiest for them to use, and we'll get it. We'll put the order through. No, that's not the way to do it. That's the patients don't know. That's going to overwhelm them. They don't know what catheter to use for them. Now, there's two types of intermittent catheters out there: hydrophilic and uncoated. So the ones that have a coating and the ones that don't. I got to tell you, my go-to catheter most of my career was the uncoated catheter. I just liked it. I can tell you the one I used all the time. It was a 114 Coloplast 114. It was a straight cath. It was 14 French, and it was soft. That was the 114s were the soft. I liked the softer catheter myself for most patients, and had a lot of success teaching with that. My big thing against the coated ones was I think sometimes they could be too slippery, and it's probably the case sometimes, but not always. And I will admit I have changed that strategy a bit. A salesperson I'd known from a previous company went to work for WellSpec, the company that makes Lofric, and the guy I really kind of liked. He was a pretty, honest guy. Wasn't just out selling. He said, he says, there's something to these pre-lubricated catheters. He says, a lot of our studies have shown that because they're so slippery, they're less irritating to the urethra. They're easier on patients. He said, I really think you should give it a try. So I said, fine, give me some of these catheters. The next guy I see, I'm going to go ahead and I'll give it a try with them. Well, I have to tell you, I was impressed. It did go well. Now, do I think everybody should be on a coated catheter? No. Sometimes patients that have, trouble with their grip, the slippery catheter is too slippery. So again, this is assessment. Decide what you think is going to be the best to use for the patient, and don't just go by because it's the better product. I will say some of these coated catheters are coming out with crazy innovations, and I've got a few samples I'm going to share with you shortly. But they are really good catheters because suddenly there's a lot of money in catheters. So they put a lot of research into how can they be better than their competitors. Now, the other thing that's different about catheters, especially for males, or only for males, is coudé versus straight. Coudé is a curved tip. The reason you would use a curved tip versus the straight one is because of the prostate. Sometimes prostates are so large, it's hard to get around them. And this kind of shows what that looks like. So I always say that, the guy who invented the Lakeshore Drive for Chicago was an idiot because he put this S-turn on the drive. Now, I don't know if they did it because they wanted cars to go slower, but anyone who's ever driven now they've actually taken the S curve and straightened it out more. But anyone who ever in the old days took that S curve, it was terrible. Well, the guy who created men wasn't much better because he put this crazy S curve over here in the, on the male side too. So the one curve is easy enough to get rid of. You just pull the penis straight, you get rid of that one curve. But the other one, the prostate, can be significant. And sometimes a coudé will make a huge difference in a soft, and some will come in a hard form. So it's, again, a choice. Why would I pick a soft catheter versus a hard catheter? Well, it depends on whether you need that flexibility sometimes, or do you need that stiffness? Sometimes the stiffness will make it go in better. So at this point, I think I'm going to my full screen here, and I'll get some samples going here for you. So these are a couple of catheters. As you can see, this one here is the straight cath, and then this one is the coudé. Now, most of these coudés have a marking on the back here that shows what up is. So you always want to insert it with it going up. This one happens to have a blue line. I'm not sure how well that's showing up again on my shirt or against me. But anyway, it has a blue line. So you can tell them when they're inserting it, make sure that you start with it going up, but then that you continue to see that blue line the whole time. So as you're inserting it, you can see that the catheter is going in with the blue line up. Or they can try to feel for this little groove. These are soft. Again, my favorite catheter, the one I would always go to first, straight, soft. And just because I've had the most success with it. Now, the reason I wouldn't say go to a coudé on every man because they've got a prostate is you don't always need it. Number one. Number two, sometimes they get confused and they put the catheter coudé in upside down. And an upside down coudé is worse than a flat straight catheter when you're trying to insert that. So my tip is to start off with this. I always work with the patient personally, and I'm going to go through some techniques of how I have them insert the catheter. So we'll go through that. But I think that starting with a straight catheter, a soft catheter works out best. Now, sometimes the stiffer ones can be easier to push for some of the guys that don't have as much strength. These floppy ones, being soft, they do bend. So sometimes that can be an issue. And you get a patient and he's getting one of these, that could be the problem. Now, the other thing is and I've got a bunch of these here, are all these pre-lubricated catheters. So we've got low fricks, and we have this one's Hollister's Vapro, and this is the Speedy Cath. All have different methods for lubricating them. I'm not going to pop these bags and make a mess all over myself, but this one has a pop bag. You pop it and it releases their urotonic fluid so that it's at the same pH or same sodium as the body, so that it doesn't draw water in or out of the urethra. That's their big claim to fame, and they patented it, so it must be something there. But it's kind of a stiffer. It's a little bit stiffer of a catheter. I almost put this at like a medium stiffness. It's not as stiff as some of the other ones, and the one I'm going to bring up here is the Speedy Cath. Now, this one's already pre-lubricated. You don't have anything to pop. You just simply open it, and go. Now this one is pretty stiff, and maybe I will open this one just to kind of show the difference between a stiff one and one that's not quite so stiff. So this one, when you're pushing, it's pretty tough to get it to kink. Now, super slippery. I mean, the beauty of these is slippery. The bad thing is it's slippery. One of the nice things about a non-lubricated catheter is you can lubricate half of it. And then you've got this part not lubricated to grip onto. Some of them do come with grippers to help push that. And I'm going to show you something like that here in a second. But even with the pusher, sometimes it doesn't do the job. Now, since I was giving the talk, I always look at my cabinet all fun to see what new stuff is in there because I don't always see all the reps. There was this new one that came out. It's called the Feel Clean Air. And it's a little satchel. It's got a bag you break, releases a fluid that then lubricates the catheter. And I'm going to show you what the pusher looks like. So this is I'll put this somewhere I don't get all wet. So this is what it looks like. It's rolled around, plus or minus on the rolling, because you can see that roll stays in it. I'm not 100% sure I like that, but they didn't ask me. So this is the pusher that they have. And, it does give you some grip, probably over trying to push on just a lubricated part of the catheter. So I like that. And again, you can advance that all the way through. Now, their neat invention, if you have to call it an invention, is the bag. So this is on the go. A lot of our population is very active and they're getting around. When you're done, you can put it right back inside the bag it came in, seal it, and throw it away. So you've got a nice, simple, and plus the other thing is, if you're carrying this, I didn't know it was a catheter bag. I knew it was a catheter because it was in my catheter closet. Otherwise, I had no idea what it was. So I think that's the nice thing is people want something that's concealable. Would fit. I guess I do have a shirt pocket. It would fit in a shirt pocket, and it doesn't even block the Euro nurse. So I like that. There was another. Oh, and I did have before that one. I ripped open ahead of time so I could play with it. But they do make it easy if you have disabilities for trying to open them. They do have it so it's easy to open. And then my last catheter sample I'm going to share with you, I have not opened yet. It's Speedy Cath because I'm curious what it's like. The Flex Coudé Pro. Sounds good, right? So it has a peel back here. Again, does not look like a catheter. Looks like it's a bag I could probably put the catheter back in to get rid of. Wow, why you shouldn't do this on live TV. So that came off and nothing happened. Maybe something was supposed to open. I don't know. There it is. So I waited so I could do this live. So I should have practiced, right? So it doesn't open up here. So don't even take the tag off. I was waiting for a big surprise. But the nice thing is it's not, I'm going to do that. It doesn't drip all over you. So, and it's all self-contained with a bag, which is kind of neat around it. Yeah. It does come apart like this. So, oh, that's pretty neat. So it does.
Did you have to twist that to unlock it?
It does have a screw tip. So it's screwed together like that. And you open it here, and I will warn you, I have a towel on my lap because I don't want to make a mess, but it did drip a little bit, but not a lot. Now this thing here can be used as a holder. It's got the coudé tip, and you can really get pretty good grip on it to push it. I like it. It's slippery, and it kind of collapses the bag as you go. Hopefully that was. The only thing I don't really see is how you can mark to tell that your coudé is going up. So that's the only thing I don't really see on it, but it does have a little marking over here. It's not real easy. I don't know if it shows up on the screen too well, but it does have a little mark. So there is a marking to show you. Kind of neat. So this is one I had just seen. I haven't seen the prior. I had heard they were coming up with one. It's definitely soft, so it wins that on my choices. All self-contained, and I'm guessing it will fit back into that bag nicely, which it does.
I think the tab that you removed may be used to secure that bag, like say on the wall of a bathroom stall, so that it keeps both hands free.
It is really sticky. So I think you're right. So if you wanted to have the bag adhered. So the other thing I want to mention is we always want to let patients know that all catheters are now labeled as single use only, as required by the FDA. SUNA has a great sheet on intermittent catheterization. It really goes into a long introduction, how to perform it, materials needed. It's really well written. There's a lot of information here. It's 3 pages of information. Now, I just put together a new patio set for my patio. I have a little place that we wanted to sit out and look at the lake and have breakfast. So it's one of these high tables and 2 tall chairs. And it's made of this polywood stuff. That's that special wood thing that's kind of a plasticky wood, composite, they call it. Anyway, I got the instructions that had to be put together. There was not one word in that instruction. Everything was a picture. And if you ever went to like IKEA and these things that you assemble your own furniture, they don't put words anymore. I think that they're smart. There's people smarter than us that have come up with these ideas. And my proposal is I think we should be doing the same thing when we teach intermittent catheterization. Get rid of the words. I mean, I know SUNA put a lot of work and effort into it, but the last page is the one that I was using, the pictures. And I think that you could come up with something similar to this, where it tells you exactly what to do. Wash your hands first. How a man should be putting a catheter. Most of the guys I taught like to just use it right over the toilet, so it's very normal. And then a picture to show that it's a throwaway, one-time use. So just like IKEA, I think that pictures are going to do much better. And the same thing for when I give women instructions. I found this one years ago. Now, this came from a talk I gave a long time ago, and I don't even know where this picture came from, so I can't credit whoever came up with it, but I love it. It just shows different techniques for women to catheterize. And a lot of times, females, guys got it made because it's a little easy, pretty easy to find the urethra. And for a man, once you find a urethra, the big problem is getting through your prostate. For a woman, it's finding the urethra, then it's home free once you find it. So, these are different ways that they can make it easier to catheterize. And I thought this is a great picture for that. Good. Again, pictures. I like, this is another one I found recently, just some more pictures on how to catheterize. I'm not a big fan of the mirror. I know people have taught with females with mirrors, and they probably can go back and forth to whether they like it or not. When you work with a mirror, up is down, down is up, and it's kind of not a one for one. So sometimes it gets confusing, but if it works, whatever works, that's all I think that matters. I always have an iPad with me because that's what I use for my EMR, and I keep some of these anatomical pictures there. And I like this one especially because it's one of the things I hear from a lot of patients is the fact that they say, hey, how far do I go in? They're afraid they're going to rupture something or, go right through their bladder. And when you show them an anatomical picture of how long the urethra is, they get an idea. And you kind of show them that even if you push it all the way, it's just going to get into the bladder. It's not going to go through your bladder. So this is, to me, a reassuring picture to show them. And now I'm going to show you my technique here for how to insert a catheter. And I like this, is what I tell them is to grab and push to the penis. Grab and push to the penis. Grab and push to the penis. And I found that technique has been highly successful for me for patients learning how to catheterize themselves. And you're only working with about an inch at a time, so it's less apt to buckle. Hope you enjoyed that episode. Be sure to join us next week for more urology information designed for the patient on UroPateint.com. Have a good day, everyone.